Dr. Kourakin, tell us what's the difference between lumineers and veneers. You know, we hear advertised on television, lumineers, and then kind of, I don't know, to me it looks they all clip-on fingernails, clip-on tooth nails, but there gotta be a difference, otherwise there wouldn't be a different name, is there?
Well, basically the difference is this. What is the difference between a spa and a hot tub and a jacuzzi? Lumineers was one of the first companies to brand name veneers. And since the development of Lumineers, there have been many different veneer products that quite honestly are even superior to Lumineers. There are many different situations that are going to call for different types of veneer material. There's quartz material there. There are various thicknesses of material that will look better. Some materials are stronger. For instance, some people grind their teeth and a very fine Lumineer may be totally inappropriate because they have such a strong and heavy bite they'll destroy the veneers. So we need a stronger material. Other people, delicate women, for instance, who are very careful about their bite and want the utmost in aesthetics, may want a veneer that has a lot of translucency, a lot of depth, a lot of pearl essence, if you would. And for them, that hard veneer is not going to be appropriate for them. They need a more delicate structure. So we need to tailor fit the material to the patient, not just simply accepting Lumineers as the end-all product for all people. It just doesn't happen anymore.
So what you're telling me is that Lumineer veneers is a little bit like me walking into a clothing store and, you know, not every suit in there, even though I like suits and walk into a clothing store with suits, but not every suit will completely fit my personality / my structure, you know, including every color, because, you know, some of us look better in other colors than in other ones and blah, blah, blah. And really, again, I suppose you, the dentist, will be saying, look, what you need here is this and that, and there's really no reason to even worry for the patient what he should have, because the dentist will know which one to fit clinically. It's really just a matter of that. Am I saying that correct or what?
You said it very accurately, Helmut. You know, we need to make the diagnosis. We need to be able to tell you what is the best material for you. You will guide us with your needs and what your wants are, but at the same time, we need to tell you how your dentition functions and then what will best satisfy your needs and wants. You know, you establish the goals, let me direct you to that goal.
Exactly. Again, like we did walking into a European clothing shop. I want to look sporty for that event. I want to look elegant. I want to whatever. And the correct fashion designer will give us what makes us looking just that way.
Absolutely.
Well, I like
it. We're very proud of the specs that we do get with our Lumineers, with our cosmetic cases there. You know, I often have said to patients, you know, that's one thing that we can create a beautiful picture. Then we go further and we want to enhance the picture with a frame. So we actually will take it to the next step. Maybe we'll discuss it sometime, you know, the work we do with facial cosmetics.
Wonderful. So what do people use veneers for, or Lumineers, same thing, we just call it veneers now, saying, I mean, I can see that if I have a chipped tooth because, you know, my neighbor punched me one because I was doing my music too loud or my garage too dirty, I can get that. But what other reasons are there that a person might need and want Lumineer? Tell us a little bit about it shortly.
Well, for instance, if a person has teeth that are crooked, malpositioned, and they do not want to spend 3 or 4 years in orthodontics, in braces, because of their age or because of their occupation, in approximately 2 to 3 weeks' time, we can recreate entire smile, and that is just as pleasing as having orthodontics done, and generally for considerably less money. So we can create the perfect combination of a smile, of a bite, because sometimes we need to recreate a bite, and that can be done with a veneer also. And it's a matter of sometimes closing spaces there that just don't look appropriate. Sometimes we need to simply change the anatomy of a tooth because we want to do things like place partial dentures where people have missing teeth, all the teeth. Perhaps they can't afford implants. So we need to change the shape of the tooth so we can anchor other prostheses onto those teeth. So there's many other reasons for that.
I see. So basically reshaping a tooth, whether the tooth is too long or too short or whatever it may be, or too narrow or too wide, you can kind of reshape it, put a veneer over it, like on the kitchen counter, I guess, and bang, it looks the way we want it to be looking.
Absolutely. Yeah, you'll see people, and some people who maybe, for instance, have a large full face and have very teeny tiny teeth. There's a ratio problem. There's a disproportionate amount of facial feature to tooth structure, and we will recreate the smile to bring that ratio more into a cosmetic line, and vice versa. We can shrink down the tooth and make a tooth that's too large appear smaller there. So there's a lot that we can do with illusion in the creation of the veneers. And it's amazing how much of it is a matter of illusion. And that is an artistic talent not many dentists really possess, I'm afraid to say, because it is something that is an art skill.
Right. I do definitely, keep to start seeing that, like, dentistry, yes, it's clinical, it's technical, and it's scientific all the way down to the last whatever, but at the same time, it's art, because, as you said, big smile, small, this, that, even the color, what matches, what pleases. And I'm very sure that in terms of like how to look and raise self-confidence, that in that area you get some of the most incredible results, where people go, wow. And all of a sudden from running around a little like this and that, they just beaming, their normal natural beaming comes out, right? All right.
That gives me such a warm feeling in my heart when a person walks in, male or female, and they're so tight-lipped, they don't want to show their teeth, they don't want to smile, and we do a case, and it just opens them up. And sometimes, Helmut, it's so sad that you will actually have to coach them to show their smile, because it had been so many years that they had been walking around so tight-lipped, so embarrassed about the smile, that I'll actually spend a whole session just saying, look how gorgeous your smile is. Open up now. Be that free person there, and let us see what you have. Let your persona come through. And after a little bit of coaching, they just open right up, and it's a whole different individual there.
Yeah. No, I can even associate that with me. I once did have a discolored tooth, and in fact it was around the time I got married, and I did the wedding pictures all with that little it wasn't all that heavy, but it was heavy enough for me to, one way or the other way, smile a little different. And nobody said anything who looks at my wedding pictures, but
they're not going to say anything.
Of course not. Of course not. But I kind of can't feel it, and I do remember when it was actually a person in New York who put on, just a couple of crowns or veneers. I don't even know what it was, and all of a sudden I saw myself. I brushed better, not because I felt maintaining them, just because I liked looking at my smile while it.
That's great. That's a motivator. It's a
Absolutely.
motivator, and sometimes we need those motivations.
Well, that's why they call it the $1 million smile. Do you understand?
Yes.
From those movie guys and stuff. It's really all it is. It's if you have that smile, it looks like the world opens.
Yes.
It's absolutely amazing. Well, I really appreciate you explaining this all so very well, Dr. Kourakin.